Recorded at Medicines from the Earth in June of 2016. For more information on our conferences, lecture notes, books, and recordings, visit our website, botanicalmedicine.org.
Chronic kidney disease. Okay, this is a really, I don't know, I've never done this topic before. I mean, generally I haven't ever done any of the topics before. It seems like every time I do a talk, it's just like a new thing. So you don't really build on an old thing. It's just all kind of ties together with some of the same concepts. But I just keep seeing this happening in the clinic. I just keep having patients coming in with chronic kidney disease. And so I figured, well, I should probably get more versed in that topic and really understand it more deeply than what I already know so I can help people more. And I have about maybe 5 chronic kidney disease cases right now with different pathophysiologies going on, things from hypertension to multiple myeloma to other diseases that, just diabetes, other causes. And so it's nice to be able to deepen my understanding, and that's what these talks really do for us as speakers, is they make us kind of like pseudo-experts in each one of these little topics. And so thanks for letting me be here and do this, and letting me spend the time to research it and all that good stuff. Thank you. So the first thing I'll say is just that, most of the time it's clinically a silent kind of disorder, right? Like you don't have a screaming symptom that says, I have chronic kidney disease, I better get to the doctor. You don't have that. You don't have a cough. You don't have a sore throat. You don't know what's going on. Your kidney function, until it declines very low, you won't even have any symptoms. Some people don't have symptoms even until they're close to end-stage renal disease. So it's a problem in that way because we're back to that prevention-cure thing again, because it's hard to diagnose this thing until it's late stage, and then by the time you get diagnosis and you're getting treated, you've already gotten to a place where you need kind of emergency care. And so now you're already into the medical establishment, you're into the biomedical treatments, you're into big expenses for our medical field, and probably some pretty challenging choices for you as an individual. So if we can find ways to identify patients who are going to be suffering from this type of a condition early on, or even predict if they might go that way, we can do a great service to the individual and to their families and to our whole culture as well by helping to treat people early on. Just get them healthy, get them well, protect their kidneys. So some of the current statistics about chronic kidney disease: 1 in 10 American adults has some level of this chronic kidney disease. It's the 9th leading cause of death in the United States. 60% of Americans will develop it in their life. And we spend about $41 billion on treatment every year. So it's a very serious condition. There's the 5-year survival rate, for somebody who has been undergoing long-term dialysis, if they're into end-stage renal disease, is about 35%. 35% for a 5-year survival once you get to that late stage. So, we really want to be able to help these folks because the modern treatments that we have are not doing the job that we'd like to see them do. So, defining chronic kidney disease. So, you're talking about a decline in kidney function, right? The GFR is the main measure. That's the glomerular filtration rate. A lot of times they just have the measure on a lot of labs will just be, either greater than or less than 60. And if you're less than 60, you're into kidney disease. If you're above 60, you're normal. Although, if you're really under 120, you're really into the beginnings of some kind of kidney damage, the beginnings of issues, some kind of problem showing up because you're not filtering your blood as efficiently as you should. And if you don't know what that is, GFR, it's glomerular filtration rate, and that's how fast blood is being filtered and moved through the glomerulus. That's the filter inside the nephron inside your kidneys. So, proteinuria, that's one of the main indicators, probably the main indicator, protein in the urine, that shows that there's a problem. There's some kind of a nephropathy. That means that the nephron is not doing the job of filtering the blood appropriately, making sure that certain parts of the blood and the plasma are being pulled out into the tubules, and then leaving behind things like proteins and red blood cells and white blood cells that are too big to pass through the filter. But when this system starts to break down, bigger proteins, white blood cells, red blood cells, compounds that shouldn't be there, get passed into the nephron. and they get passed into the urine. And we can pick those up in the urine, and that's what normally is the first indication that someone has chronic kidney disease, unless, of course, they've got a more advanced condition and they have things like edema that are very obvious. So uremia is the presence of urea and creatinine in the blood. These are nitrogenous wastes that the body's supposed to get out of the blood, put into the bladder, and excrete through the urine all day long, every day. So the stages of kidney disease, stage 1, you've got some kind of kidney damage that happened, and kidney damage is an interesting thing. Most of the time you don't really know what it is. Of course, just aging, just being alive is taxing our kidneys. We have to deal with the fact that we're living in an oxygen-rich environment, and we're dealing with free radicals all the time. And so we're constantly at the whim of nature. We're doing our best to overcome this process, but ultimately we're aging and our kidneys are slowly failing. And if you've run a clinical practice for any length of time, you see elderly folks, especially you get those wonderful people in their 90s, a lot of times their GFR is just low. They don't feel anything, just the fact that they're just older and they have issues with health in general. But as far as they're concerned, their kidneys are doing great. But then you look at their GFR and it might be 30, it might be 35. And that's just an indication that over time those kidneys have gotten worn out. You can just see here we've got stage 1 through 5, kidney failure, a level of GFR less than 15. That's when you're going to be on dialysis at that point. You can't maintain levels of filtration that keep your blood in a homeostatic balance that allows you to stay healthy. You'll end up with too many toxic wastes in your blood, and you'll end up dying from that condition. And probably not in a very fun, happy way. Not like dreaming of being in paradise and dying, but probably a painful kind of way to go. So let's talk about, I hate these things. Okay, here we go. Let's talk about Chinese medicine, because that's what I like to talk about a lot of the time. Aging and chronic kidney disease is just basically, that's just understood as the truth. That's just how it's going to go. The kidneys are, in Chinese medicine, the source of our congenital essence. It's where we get the material to rebuild ourselves every day throughout our lives. We get it from our parents, from the congenital, from our genetic line, about how kind of our constitution, what our will is, how strong we are. That's in our kidneys, and that's then given out to our body throughout our lives via the kidneys, via the adrenal glands, through the endocrine system. And over time, as we age, that essence slowly is declining. We're using it up to remake ourselves all the time. Well, of course, we replenish that by eating a good diet, being able to take in a lot of nutrients, absorb our foods, even breathing good air, staying calm, slowing the burnup of our essence. There's ways we can inhibit that slow loss of the essence, but over time we're going to lose it. And as we lose it, we don't have the ability to deal with the stress of just being alive. Like I said, we can't quench those free radicals. We can't quench the fires that are slowly taking control of us as we get older. And it'd be really cool if you could just take antioxidants and you'd be all good, but that only worked in fruit flies. It didn't work in any other animal or human that they tried to give antioxidants to. It doesn't make you live longer. So there's more to the picture than just oxidation, antioxidation. Blood, yin and yang, these are concepts from Chinese medicine that are very important, that relate to the essence. The kidneys can decline in different ways with different people, depending on their constitution and depending on their clinical picture. Whether they have more of a deficiency of yin or deficiency of yang. And we're going to talk about that a little bit further on. And if you can understand that stuff right away with your patients, it's great because you can apply therapies more appropriately. And even if you're using Western herbalism or if you're a nutritionist, having the basic understandings about yin and yang, the natures of things, hot and cold, those are really important things to help direct your therapies and make your treatments just basically at the simplest level more accurate for the patient. So the biomedical side of it is that your kidney function is declining. Well, same thing. Your essence is declining in Chinese medicine. Your kidney function is declining in a similar fashion. Declining renal mass. This is something that's shown up in the research, looking at, people who have passed, who are older, their kidneys are smaller. You lose renal mass in a considerable amount. By age 70, I think people have lost about 35% of their renal mass. And so, what is renal mass going to be associated with? Well, it's associated with more nephrons. And every nephron has a filter in it, a glomerulus. And that filter is how we keep the blood purified and perfect and just the right balance for us. Less of those means less filtration. And the number of glomeruli you see there, glomeruli are the structures that are part of that. That's the glomerular apparatus, or the juxtaglomerular apparatus as it's officially called, is where we filter the blood. And glomerulosclerosis is the process we're going to talk about today. That's the basic underlying tenet of what chronic kidney disease is. And there's a few different variations on that, and it gets pretty complex. And you can talk about nephritic syndromes, more inflammatory type of kidney diseases, but also glomerulosclerosis based, or nephrotic syndromes that are less inflammatory and have more to do with other processes. But they're all kind of going to come back to this idea of glomerulosclerosis. And as we know, as we age, what do we notice? We notice that we begin to harden up a little bit. Everything hardens. Our vasculature hardens. Our joints harden. Well, that's happening inside of our organs too, inside of the kidneys. It's happening inside those little blood vessels in there. We're slowly hardening. We're calcifying. It's much easier to be flexible. I hang out with my 1-year-old and she's like, her foot's over her head and woo, she's all just gummy. But already at my age, I'm already feeling like, God, I'm not quite as flexible. And as we get older, that's what's going to happen. It's that loss of flexibility that's a big underlying facet of what we're talking about today. And we'll see how that plays out at the level of those blood vessels and those little filters, those little fine structures that need to be flexible in order to do their job. Basic kidney anatomy. You can just see you've got the ureter. There's the big white structure. You've got your main vein and artery for the renal system. You can see a nephron up there at the top. You've got vasculature coming in and out of the kidney, and that's the kidney, the cortex of the gland itself. The nephrons are located up in that section. You can see how they're long tubes that have loops in them, and those loops are places where different filtration and reabsorptions are taking place. This is the nephron. So you can see right there, that little structure in the center is where most of the filtration occurs, where the blood is being pressed through those small capillaries, and the pressure is pushing the blood and its filtrate out into that Bowman capsule, which is that outer structure that's connected to the nephron, the tubule. So all this different material, filtrates, salts, electrolytes, pieces of the stuff that makes up our blood plasma, is being pushed out into that Bowman's capsule, and it's being brought down into the next section of the tubule, which then interfaces again with the blood vessel. So this gets a little bit more close up and shows us a little more specifically. You can see that initially, as the Bowman capsule takes in the filtrate, then the blood continues to pass along the tubule of the kidney, of the nephron, and then there's some more interactions that happen. Number 2 there says that useful substances return into the blood from what's been filtered. So some things get pushed back into the blood. And this is, of course, a complex network of cells that are doing the job of deciding what's going to happen. And there's feedback with the endocrine system, secreting glands from other parts of the body, helping the kidney decide what do we keep, what do we not keep. And that's all happening at a big level, and this is all happening at a microscopic level, and at a very small, gross level. Number 3 there, you can see that the blood then is also bringing some of the filtrate, some of the materials that are waste that got left in at the first pass are getting put back into the tubule again. And then at number 4, more water is being absorbed into the bloodstream to preserve the water and make the urine as concentrated as is really, physiologically good for us, so that the urine is able to pass and it's, we can sit in the bladder for a while, and the blood has all the nutrients that we need. I want you to understand the basic structure of this nephron, because that's what we're talking about. In this little area right here, the glomerulus is really the focus of the micro-rational perspective on this disease. And in my talk yesterday, I talked a lot about the difference between the macroecological approach, which is looking outside at patterns in nature, looking at big things, patterns in the stars, patterns in the community around us and the people around us, looking at the rivers, the way they flow, the mountains, and deriving from the patterns and how nature works and applying that to our bodies. And then the other way is the micro-rational, which looks at microscopic details, individual particles and their interactions and mechanisms. And the two are very complementary as long as we allow them to be. So what are the causes of chronic kidney disease? Well, they're all listed right here, a good bit of them. Diabetic kidney disease. Diabetes is one of the big causes, and that's, we already talked about the fact that we've got reactive oxygen species, right, and it's damaging the small structures. Well, if you have high blood sugar all the time, you're going to be glycating. You're going to have those glycation end products, these products of sugar being bound to proteins, causing this oxidative damage and increasing the rate at which things are breaking down. These oxidative byproducts doing more damage to the small structures. Diabetics often have problems with their eyes, right? You get retinal detachment and macular degeneration, cataracts. The eyes break down. down. It's just the same thing that's happening. What's happening at the kidney in these small structures. Hypertension, rampant in this country, big cause. More pressure in the filter, easier to damage the structure. Vascular disease of all different kinds, metabolic syndrome, that's where you've got the high blood pressure, the problems with lipids, you've got the blood sugar handling issues. Nephrotoxins, anything we take in, whether it's part of the soup of thousands of chemicals that we've created that we're taking in every day, we're trying to metabolize them, or if it's things like chemotherapy or radiation for people, it can be just something that you didn't know you got in your mouth, and it was something that was renally toxic. It damaged the kidney. Sometimes people get exposed to certain drug overdoses. There are issues with things like heroin, other things that cause damage to the kidney that are nephrotoxic. Smoking is a toxin. Glomerular disease, and that can be primary or secondary, where there can be autoimmune causes. There could have been a damage earlier. It could be something secondary, like the hypertension, but the glomerulus is breaking down. Kidney stones, the buildup of the cysts in the kidney that it limits the amount of nephrons that are available to do the work of filtration. Tubulointerstitial disease, that's where the tube and the spaces in between the cells are being damaged, and this is part of this process of glomerular sclerosis. It happens also outside of the glomerulus, around the tubules as well. It's this oxidative damage that causes this problem. Obstruction of the urinary tract. Men who are getting older have prostate problems. I've seen this a number of times in my clinic, where the prostate backs up. A man their urinating difficulty has gotten to an extreme place. They finally go in and see somebody, realize their bladder has 48 ounces of fluid in it, and they've got something like hydronephrosis, where the kidneys have just totally atrophied under the backup of urine, that the kidneys have been doing their job, but it doesn't go anywhere. It just sits in the bladder. And then they get kidney disease that way. Congenital birth defects, and unrecovered acute kidney injury. That's, again, some kind of an acute damage to the kidney, mostly from a toxin, some kind of an environmental insult that leaves the kidneys damaged. It damages the filter. So what are the symptoms? We've got, obviously the aging population shows the kidney disease the most. That's the most prominent, although we get it in children for different reasons too. Fatigue, lassitude, loss of appetite, difficulty sleeping, muscle cramps, urinary changes, dryness, dry skin. A lot of different symptoms can come up when the kidneys are starting to lose their ability to filter the blood. All kinds of different problems, and these are just some of them. More kind of symptoms of declining renal function. If we look at it more on a global level, you see with that loss of mineral balance, a lot of times people are getting cramps in the muscles. The muscles are cramping up, especially at night. Sexual function, losing libido, losing erectile function. From Chinese medicine, that's also, the kidneys give you the force to give you the will to make love, to reproduce. They're a part of the reproductive process. Respiratory disorders and the vasculature of the lungs affecting the vasculature of the kidneys. There's a really close relationship between lung and kidney, both biomedically and in traditional medicine. Frequent urination is another one. The kidneys control the gate of the bladder, the prostate, and in women, the urethra. That whole process is kidney controlled. Low back pain. The kidneys rule the low back. And when you get low back pain, and then knee pain is another one too. People often with kidney problems. So what I was saying before, if we can help see, I'm coming in, I've got low back pain, I've got knee pain, I've got frequent urination. Well, hey, this person's likely going to proceed over their life, progress to chronic kidney disease. So let's get them well. Let's treat this thing. Let's get it before they get to that point. Some other signs there, digestive type things can happen, poor appetite, loose stools. When the kidney energy is weak, neurologically, you get other problems in the body because it's a foundational system for our whole endocrine and neuroendocrine system. So some key terrain factors. Inflammation is a big player in this process, okay? These are some of these compounds, transforming growth factor beta, tumor necrosis factor alpha, the interleukins, nuclear factor kappa beta. These are inducers of inflammatory processes in the body. They're very inflammatory. We always get excited because things like turmeric would target all of these and shut them down and inhibit those inflammatory mediators that trigger the cascade of inflammation that results in tissue damage. It's part of the healing process, but it's also part of the damage process. And you'll find that the kidneys actually, they're challenged in one way because there's feedback loops that once inflammation and immunological activity gets going, it kind of negatively feeds back on itself, and it's a progressive decline after initial damage. So we talked about oxidative damage. We've got calcification, hardening and stiffening of the arterioles, stiffening of the tubules. This is a big issue. We don't have flexibility. We can't allow nutrients and things to pass through permeable membranes. We have fibrosis and scarring. Fibrosis and scarring is a big piece of this as well. We would say blood stagnation in Chinese medicine, stagnant blood, it's not able to flow, and it's leading to the material of the kidney right around that nephron actually becoming scarred. And inflammation leads to scarring. We know that. So as the tissue is scarred and fibrosed, it doesn't flex, it doesn't bend, it doesn't allow things to pass through, and we have the makings of our chronic kidney disease. I put up there mesangial cell proliferation. The mesangial cells you're going to see in an image coming up, those small cells that are in between the glomeruli, they're inside of the Bowman's capsule, inside those blood vessels, and they're basically creating the space in between the wrapping of those capillaries, and they start to proliferate under these inflammatory signals, and they start to take up a lot of space, and they lay down a lot of collagen too, and they start to make this a very tight space, and they block the vessels, and then the vessels aren't able to filter nearly as much blood. Cardiovascular disease, right? The leading cause of death in the population of patients with chronic kidney disease is cardiovascular disease. We're talking about the same stuff. Oxidative damage, hypercoagulation, hardening of the arteries. We talk about arteriosclerosis, right? Atherosclerosis. We're talking about the breakdown of the cardiovascular system, and the kidneys are really just an extension of that vascularity. So the two things play together in the same pathophysiology, and so a lot of our treatments are actually the same. Does that make sense? You guys understand what I'm saying? Okay. Am I doing okay, you guys? People are kind of like looking around like, what is going on here? You guys okay? Okay, good. Okay, so we've got some basic serum biomarkers. I just want to talk about a few of these things. You know, your complete blood count, where you look at the different cells in the blood. A comprehensive metabolic panel, which kind of looks at the liver function, looks at the kidney function by looking at the electrolytes, looks at the filtration, things like creatinine and blood urea nitrogen. This is a really good way to kind of see things just on the whole. And these tests, like the comprehensive metabolic panel, which your doctor kind of standardly runs when you go in for your physical, it's a test that really isn't testing for your health. It's not testing to see whether you're healthy, whether you're optimized. It's testing to see whether your organs are failing. So when somebody goes, I went to the doctor, everything's good. That's not what we do. We're herbalists. We go, no, look at your skin, you got a little rash right there, you know, and you said you got fatigue and you're having some bowel trouble and you're not, you know, you're just not having the libido you used to have. Now we have information. You're not optimized. Even though your blood count looks perfect and your TMP is perfect, your organs aren't failing yet. Let's treat you now. Let's not wait till your organs are failing to treat you. You know, we don't need to treat your cardiovascular system when you're having a heart attack. We should treat it way before that. We don't want to treat your kidneys when you're having chronic kidney disease and you need dialysis. We'll treat it before that. So this stuff is good, but our ability to see the person on the macroecological perspective and take them in and understand how we can support them is much more important to me in the long-term management of this disease. So blood urea nitrogen and creatinine, we talked about that, the kind of the main markers in chronic kidney disease. Vitamin D is a big player we're going to find, and both that's the storage form and the active form. I'm going to hit these later on. The minerals, magnesium, super important. Calcium, big part of this picture. Why are our bones calcifying, or our blood vessels calcifying? You know, they're calcifying because calcification is calcium. And there's a combination, calcium and phosphorus and part of the bone matrix. So all together makes these conglomerates that build up on our tissues inside our endothelial linings. We don't want that. That's not good. So we don't want to have high calcium. And, you know, all your patients who come in and they're taking, you know, I'm taking 1,500 milligrams of calcium a day. Well, you're causing yourself to have kidney stones, bone spurs. You're causing yourself to have hardened arteries. Not a good idea. We have a lot of calcium in our bodies. I mean, our bones are basically a bank of calcium. You have so much calcium in your body. And our foods are rich in calcium. And we'll find that vitamin D and calcium together, the way they interact, is how we decide how much calcium we're going to take up from our food or we're not going to take up from our food. That's a big part of this picture. Phosphorus is another big one. It's bone matrix. Potassium, got to have potassium and magnesium in the right balance. Electrolyte balances get way off. The kidneys control that electrolyte balance, and when they aren't working well, the electrolyte balance goes off, and then other problems happen. Urinalysis, looking at the protein. What's coming out? Are things coming out in the urine that shouldn't be there? That's really important. That will give us clues. And the pH is one that I look at a lot. And we'll see that later on in the talk. I love to just run the pH. I have pH strips. I give my patients pH strips just to check their urine. What's going on in there? Inflammation, C-reactive protein, and homocysteine. These are big markers. Homocysteine is an important one in kidney disease because people always think of it as related to folic acid and related to the methyl tetrahydrofolate reductase pathway, but it's actually elevated higher in chronic kidney disease. Chronic kidney disease will show you a high homocysteine. Someone comes in, homocysteine's at 24. Oh, I'll give them a bunch of folic acid. Well, it's not necessarily an MTHFR problem. It's a kidney problem. So we got to fix their kidneys. Probably some folic acid is part of that picture, but that's not the answer. Fibrinogen is a marker of literally fiber in the blood. The fibrin in the blood. How much fiber is there? How stagnant is the blood? How much coagulation is happening? It's a great marker for that. Galectin-3, these galectins are compounds that are associated with a bunch of different processes in the body. Galectin-3 specifically relates to cancers and metastatic cancers, and it also relates to kidney function and kidney decline because it's associated with fibrosis. Higher galectin-3 levels leads to more fibrosis. So what does that mean? More scarring, more blockage, more backup of the ability to filter in the kidney. Some bone-specific markers, just put those up for you. You can do one called the bone-specific alkaline phosphatase, which is where you look at the alkaline phosphatase, which is normally a liver function test, but you ask for an isoenzyme that tells you how much of it's coming from the bone and how much of it's coming from the intestine. And then you can see the percentages, and it gives you an idea of how much of that phosphorus is being released from the bone. It's a really good marker also to see bone turnover. So proteinuria, we talked about this, is really it's the underlying kind of way that we see that there's a problem with the kidneys. There's protein coming out in the urine. When we reduce the amount of protein that comes out in the urine, we're helping. Even if we don't microscopically know how much we're helping and where we're helping, when we reduce the protein in the urine, we're helping. And we're going to find that a lot of our plants do that remarkably well. Hypertension, it's such a huge problem. Why do we have hypertension? Obviously, as herbalists, we don't want to just say, what's the best herb for hypertension? Well, and I could say Rauwolfia is probably my favorite herb for hypertension. I use it in low doses as a single agent, or I use it in formulas. But it's a very specific herb, and not everybody's comfortable using it because it's a powerful herb, But it works really well, and sometimes it'll reset the central nervous system, and actually after about 5 or 6 months on that herb, hypertension will be maintained. The reduction will be maintained over time. So you get a good benefit up front, and it often lasts for a long time. But that's not addressing the problem, the reason why the person has hypertension. And most of it's due to stress and liver problems, people being upset and angry and frustrated about life, overworking, eating terrible foods, just, the things that we know lead to hypertension. We've got to treat those things. Of course, we've got to manage the hypertension too, but people just going in and getting an ACE inhibitor to inhibit the conversion of angiotensin 1 to angiotensin 2, which then increases blood fluid dynamics and blood fluid volume and increases our blood pressure. Well, just doing that, it didn't address the problem either. So we need to address the constitution of the patient, right? That's what we want to do. So diabetes, I was saying how important diabetes is. You get these glycoproteins. These are proteins that have been glycated, and now they have sugars attached to them. You've got all this extra, you've got oxidative stress. The lipids are being oxidized. You've got all these byproducts of lipid peroxidation. We don't want that. You've got free radical scavenging enzymes being broken down because they're all being used up. So now you can't quench the little fires that are happening. You can't stop the damage. You've got vascular damage. Advanced glycation end products are building up. So you've got more of these things. And those things are basically, I think of it as rust. Advanced glycation end products, AGEs, those are like rusting the blood vessels. And the blood vessels have iron in them, just like your car starts to rust and break down. Your vessels start to rust and break down. They get damaged. RAGE is actually the receptor for advanced glycation end products. There's actually a receptor for these compounds, and it gets activated. And it gets activated by other compounds too. And it leads to further progression of this process that we're talking about. So proteinuria and polyuria, these are the markers when you have diabetes. You've got sugar also coming out in the urine. Sugar, I didn't put that up there, but having sugar in the urine is another one. And you can have urine test strips in your clinic and just run people's urine and just see these things. You can be the first one to catch a problem, an indication. It's not as accurate as doing a urinalysis through the hospital lab, but it's generally right on as far as the comparison goes for how severe one of these conditions is. Multiple myeloma, I want to talk about this disease. It's become pretty present, as far as I can see, at least in my practice. I've got several multiple myeloma patients right now. One of them that I'm active with has chronic kidney disease as well. And it's an interesting case because it kind of gives you an example of how some of this kidney disease can work. You see that 50% of the newly diagnosed patients with multiple myeloma, they're diagnosed because their creatinine clearance is only down to half. So they're only clearing out half of the creatinine, that toxic nitrogenous waste, that they should be. And then they go, well, what's wrong with me? That's the problem. And then they go to a hematologist and they get a bunch more workup, and they find out that they've got this monoclonal protein, a protein that's being created by some of the plasma cells in the bone marrow. And the plasma cells in the bone marrow are all one cell that got aberrant and just replicated on itself over and over again, and it's just making the same immunoglobulin over and over. And that immunoglobulin is basically a big protein that's glomming up the filters, and the filters are getting blocked. They're getting basically blown open. And so it's causing this what's called cast nephropathy, where you have these sort of tubes, forms of red blood cells, white blood cells, other components, proteins, things that are coming through in the glomerulus. They're getting through the Bowman's capsule, and they're not staying in the blood. And that's another indication. These things are called free light chains. That's kind of the light chain on the protein. The immunoglobulin has a light and a heavy chain. The light chains are what are being measured in the urine. That's what's damaging the kidney, the nephron. And then in lupus, which is kind of the exemplary autoimmune disease, there's a lupus effect in the kidney, like a renal lupus that's pretty present too. It has, it's not as rare as you might think. It actually leads to a really rapid decline in some patients of kidney function, where the autoimmune process in lupus is directed at the kidney, and you get this through the immune dysregulation. The immune cells get brought into the glomerulus, and they start to do their work. But their work involves a lot of inflammatory processes that leads to further damage to the tissues and more scarring, and the same process is unfolding. So the induction of cytokines, these are signaling molecules from the immune cells. These are things like the interleukins. They are a big part of the cascade that I talked about, in that's kind of like this cyclical nature to the inflammatory immunological response. And in an autoimmune condition, it's that regeneration of the process that causes the damage to continue, and it's progressive. So fibrosis, this is like a central target. If you want to target chronic renal disease, fibrosis is a central theme. It's just in all different causes, all different kinds. This is a place where we can target our patient's problem. It's the principal process underlying the progression of chronic kidney disease to end-stage renal disease, stimulated by inflammation and oxidative damage. Those same processes lead to the fibrosis. There's a uniform response across these different disorders, the nephropathies, the nephritis, the focal segmental glomerulosclerosis. It's all set up on a backdrop of fibrosis. Oh, did I say that enough? You guys got that? Fibrosis. Okay, this is really important. So the negative feedback loop, I kind of talked about how this, in a lot of these compounds, these inducers of inflammation, these inflammatory compounds, these compounds made by the immune system, they're part of this signaling system that once it gets going, it's really hard to shut it down. So here's some therapeutics for fibrosis from a Chinese medicine perspective. We want to try to invigorate the blood. We've got herbs like angelica and ligusticum. We've got red peony and radix mouton. These are like herbs that just kind of induce blood circulation. They're not like heavy duty, but they get the blood moving. We've got herbs to remove blood stasis. There you got turmeric, right? Like I said, it's in this process of looking at the kind of macroecological, where we say, hey, these herbs are going to really help to kind of keep blood flowing and break up some of the blood stasis. They're also being examined at the microrational level, and they're being identified as plants that downregulate TGF-beta and NF-kappa-beta. They regulate immune function. They start to reduce the inflammatory and cytokine-mediated fibrosis through regulation of these compounds, through these other inflammatory mediators. Phlocarthamus, that's the safflower. We're going to talk about that one a little bit. The persica seed, and Salvia miltiorhizum, one of my favorite herbs. That one is the danshen, the Chinese salvia. Incredible herb for the cardiovascular system, which now we know is directly linked to the vascular network inside the kidneys. Breaking blood stagnation, this is another level where you actually want to get in there and break up stagnant blood that's well established. So again, when there's a lot of fibrosis, we need to go deeper. And some of these herbs, like the Zetoaria and the Sparganium, these herbs are used more in really intense menstrual problems where women have lots of purple blood and clots, and it's just painful. They can't get blood out. They're really great in that context. That's a lot of times how they're kind of understood and how you're taught about those herbs. But they do that job of breaking blood stagnation in other places too, in the brain, after traumas. And then there's another plant here called Schwager, not a plant, I should say an herb, and it's a leech. And the leech has in it a group of compounds called hirudins. And hirudins are very much like heparin. They act like heparin, and they're really good for inducing that anticoagulant effect. So I'm crossing models here, right? I'm going from coagulation, anticoagulation, to blood stagnation, resolving blood stagnation. And I'm kind of paralleling the two because that's what we're going to find, that plants that reduce blood stagnation also reduce the fibrinolytic problems that we see at the microrational level. Okay? And there's great data to support this stuff. So I just threw these up here just a little bit ago. You don't have this slide, but some enzymes that are great for digesting fibrin in the blood. Nattokinase from the nattomiso. This is a really wonderful compound. You can dose it pretty high. 100 milligram capsules, once every 8 hours you want to dose it. You can do it 1, 2, 3 capsules every 8 hours depending on the degree of kind of blood stagnation or coagulation issues a patient has. And with the chronic kidney disease, you're not as concerned as you would be with the cardiovascular issue of coagulation where you're looking at an embolus. You're more concerned with coagulation in the sense of how is it playing into that cascade of damage. So you can give it to people and not worry, well, are they protected? They don't need to be on warfarin to make sure they're protected from a clot. We're not talking about that level of intervention. Lumbrokinase, this is the earthworm-derived enzyme. It's a very powerful enzyme. Both of these enzymes work on plasmin. They induce plasminogen to make plasmin, which then breaks down the fibrin. Okay? So they're really nice in the sense that they don't inhibit platelets from aggregating, and they don't inhibit vitamin K from allowing your platelets to clot, from clots to happen. They really work in the presence of fibrin, which makes them a lot more utilitarian for us because they don't have to be monitored. They're not going to cause you to have a big bleed. I've had all kinds of people on all kinds of amounts of these compounds, especially with cancer where you have lots of hypercoagulation. And they're very safe. And lumbrokinase is another one. There's only 2 companies that make it that I know of, and one's Canadian. It's called Buloki, and that company makes a good product. It's a little pricey, but it's just a little bit more powerful than the natto. If you really need to get in there, if someone's really suffering and they need to get some antifibrotic, anticoagulation type effects, the lumbrokinase is even stronger. I think it's BOLUOKE. I think they're going off the fibrin digesting units. I have to get the details for you. But the capsules that I use, I go anywhere from 1 capsule twice a day up to 3 capsules 3 times a day. And in a case like this, I would only probably use it as a little adjunctive. Like both of these would be adjunctive to botanicals. So you wouldn't need to use huge doses of them. But I think that we'd find that using a lot of antifibrotic therapies is going to be really effective. It's just an area that we haven't really focused yet, whether botanically or otherwise. And in the declining kidney, you'll see that in Chinese medicine around 1800s, some of the doctors came out and said, well, these people are all deficient in essence. That's true, and we should tonify them. But the other problem they have is their blood is stagnant. And if we don't move their blood and clear the stagnant blood, we're just tonifying into their problem. You're building into a blocked system. I've talked about this a lot in other classes. You don't want to tonify into a damp system. You don't want to tonify into a stagnant blood system unless you either resolve the dampness first to make room for the tonics, or you clear away the blood stagnation so that you can get tonification. This drug, Trental, I like it. It came from theophylline, which is from tea, and it's a really cool agent. It's not used very often. I just mentioned it to you because if you have people that need extra layers that are deep into chronic kidney disease and they really need support, this can be something you can use. It's 400 milligrams BID. It's a pharmacy prescription. If you're a naturopath, it's in your repertoire. And what it does is it basically helps to shape the red blood cells and the corpuscles and the small capillaries, helps them become more flexible. It creates a little bit more movement through fibrotic areas. The reason I know about it originally was because Dr. Dwight McKee taught me to use it in people with cancer who underwent radiation, who had radiation-induced fibrosis in their tissues. And there's some good data showing that with vitamin E, it prevented radiation-induced fibrosis. It helped people to get blood flow to areas that had been severely damaged. So then I started digging around and I found that, actually there's research on this agent in kidney disease too, for the fibrosis, because when all those vessels are fibrosed and they're pinched down, well then if you can help to mold a little bit and shape and make the vessels more flexible, the blood cells can get through there and the tissues can get nourished. So glomerulosclerosis, so scarring of the glomerulus, focal segmental glomerulosclerosis, that's where it's focal into certain areas, it's segmental, it's not on the global level, it's not everything is falling apart, but there are areas that are damaged. That's what that is. FSGS is one of the main causes in chronic kidney disease. My uncle actually just went through this last year. He was diagnosed with FSGS, and they didn't know why. You know, he had hepatitis C for a long time, and you know, maybe that was a cause, maybe not. They've connected HIV with FSGS. That kind of comes out of the blue, but about 30% of the cases are just have an unknown etiology. They don't know why. And for us, it's not as important to know why. It's important to know how do we treat it. So here's, up in the left corner there, a normal functioning glomerulus. Those are those mesangial cells. They're in the middle. They're mesangial. Those are the cells that are kind of gluing it all together. Then you see that as things start to progress with the inflammation, the immunological activity, all these regulators of fibrosis, you start to see that they proliferate. They start to grow. And as they grow, they're taking up space. And as you see down here, the hypercellularity and the expansion of the matrix, the extracellular matrix, it gets thicker and more collagen-based. And there's less room for things to move. And you see there's a stenosis of the vessels, and now less blood can be filtered. So what do we do from the biomedical side of things? We use angiotensin inhibitors, right? Angiotensin converting enzyme inhibitors to block that conversion of angiotensin. We use blood pressure lowering agents like angiotensin receptor blockers, ARBs, but again, we're just dealing with the symptom. We're just blocking one aspect of the process. Blood sugar-directed medications for diabetics, metformin, insulin, other kind of the new glipizide drugs or other new drugs that are coming out for diabetes. Corticosteroids. Steroids always are, a go-to for the biomedical side of things. Shut down the inflammatory process, right? And that's going to cool down the immune system. It's going to cool down the building of new fibrotic material. Immunosuppressive drugs. These are, obviously these are more for autoimmune conditions or for people who have transplants. And then dialysis. And ultimately renal transplant. With dialysis, things are given with it because dialysis isn't a perfect system, right? You're basically taking an exogenous system to filter your blood, and we do the best we can, but it's not the same. And problems come up, and people don't live forever on dialysis. It's a gradual decline. But we can help those people. And the herbs I'm going to talk about, you can give them while they're on dialysis, and it works great. So prevention, this is... Treating an illness after it has begun is like suppressing revolt after it has broken out. Right? If someone digs a well when thirsty or forges weapons after becoming engaged in battle, one cannot help but ask, are not these actions too late? Maybe if all the therapies we have are the ones we just talked about, it's kind of a too late type of thing. But with the plants and the nutrients, we're not too late. We can still help these folks. Kidney disease is a very slow progressing process. So even small changes in slowing down the disease decline, the disease process, is very powerful. It can give people years and years of life. So 8 principles of Chinese medicine. I tend to put something up about this every talk. I just think it's so important. Is disease yin or yang? Does it have a slow process? And chronic kidney disease, unless it's a very acute damage that causes an acute loss of kidney function, then it's going to be a yin condition. The acute thing would be a more yang condition where it happened really fast. A yin condition would be a slow, gradually progressing process. Hot or cold? Is this a condition that's hot? Does it have hot symptoms? Does it have cold symptoms? And I'll go into that a little bit further as we move on. Is it an excess condition? Is the person having a lot of stagnation? Do they have a lot of pathological factors? Are they just really full and they have too much? Or is it deficiency? Are they really weak and feeble? Are they cold and they feel really deficient? And we need to be able to identify the differences. Yes?
When you talk about the anti-inflammatory parts and the thinning the blood a little bit parts, do you ever find yourself using fish oil?
The question is, can you use fish oil for thinning the blood? And absolutely. Yeah. There was some interesting research on the polyunsaturated fatty acids. I was digging around in there. I was going to put some up on it, but there's a little conflicting stuff about omega-6s and 3s, and I just couldn't quite get clear on how much benefit there was, and I couldn't find a lot of good data with chronic kidney disease, so I left it out of the talk. Yep, and that's the prostaglandins and that whole thing, and that's a good area to think about for sure. And I think that the oils are good generally. Those the EFAs. Is the disease internal or external? Is it something that came from the inside of the body and built its way up, or is it something that's coming on the outside of the body and afflicting the body from the outside? So the kidney network in Chinese medicine, the kidneys are associated with the essence, they're associated with the bone marrow, they're associated with the neurological system and the bone itself, they're associated with the brain and its development, the spinal cord, the neurological network, It opens into the ears, the kidneys, and connected with development. I talked about the essence, right? The congenital essence, the beginning of our life. And that's our genetics. Our genetics come from our parents. They come through there. And the kidneys are supposedly, in Chinese medicine, the place where that source of us is, that genetic source of our life and how we make ourselves. That's coming from our folks, and it's stored in our kidneys. And the kidneys decline with age. Well, that's what we said on both ends of it, right? It's the same picture. So in Chinese medicine, we want to differentiate syndromes, right? What organ networks are being affected? What are the deficiencies? What are the excesses? What are the relationships between organs? And then we want to make a diagnosis that represents the principal patterns underlying the disease process. And that's kind of like a traditional medical approach, a macroecological approach. Gather up the symptoms, gather up the patterns, and then come up with a diagnosis. And when we look at things like, having heat, having cold, having excess, having deficiency, you put it all together and you go, oh, that person right there, their kidneys are weak because they're cold. That person doesn't have enough yang energy. Let's say that they don't have enough warming force in their body. They're weakened and they're cold. Well, now what we want to do with that person, we want to warm them up. Someone else might be really hot. They're just hot. You can tell because their face is red, their ears are ringing all the time, they get upset easily, they're always trying to throw the covers off, they have night sweats. That person's got heat syndromes. That person's going to need to be cooled down somehow. Okay? So here's a few of the primary deficiency syndromes in Chinese medicine for chronic kidney disease. Kidney essence deficiency, we talked about that. That's that just gradual decline over time. That's the breakdown of that quenching network, the breakdown of the ability to deal with the stress of life. Then you've got the kidney yang deficiency. That's the ability of the body to warm itself up, to create the movement of energy around the body to support all the structures. That's the kidney yang. It controls the gates, controls the bladder. It does a lot of things to lift the energy in the body. When people are yang deficient, they have a whole bunch of symptoms I'm going to show you in a minute. Kidney yin deficiency, just the opposite. Kidney qi deficiency, I won't talk a lot about, but that's more about a part of the qi, which is sort of the kidney that is like, we would say maybe the ATP-based part, the energy generation, the mitochondrial function of the kidney, and its ability to really control the gates, control the bladder. It's associated more with urinary difficulties, urinary problems, especially like urinary frequency and inability to hold the bladder. The qi would be that lifting force to maintain the structures locally associated with the kidney. And then blood deficiency I put up here because a lot of people as we age, like I said, everything is getting dried up. It's not nourished and moist and juicy and flexible. That's the blood deficiency aspect. So kidney essence, drying of the blood, contraction of the ligaments, withering of the flesh, reduction of vitality. These are all parts of this process of the kidney breakdown, the loss of our essence. I talked about the low back, the knee pain, fatigue, the decreased sexual function. The teeth are a part of that process, and the kidneys manifest in the teeth. So tooth decay and weakness there. And then things like dizziness and deafness and tinnitus, ear ringing. That's a big kidney sign. Ear ringing. Always ask every patient, do you have any ear ringing? Do you have ringing in your ears? Do you ever get night sweats? I always ask those questions. Kidney yang deficiency. This is chills, aversion to cold. Someone who's more pale in their color versus the hot type of person is going to have redness in their face. This is a person who's got whiteness in their face. They're pale, they're wan, they're lethargic, they don't want to move. They don't have that up and go yang, I want to get up and do life. They've lost that. Low libido, frequent urination again, and loose stools and diarrhea, especially when it combines with the digestive system's yang energy, that energy of the digestive system that lifts the body. When all that fails, then literally you start losing your bowels. Like people wake up in the morning and just have diarrhea. It's called coxcrow diarrhea, very common, kidney and spleen yang deficiency. Kidney yin deficiency, this is soreness of the low back and knees again. Well, pretty much all the kidney stuff, right? When you have kidney problems, they're ruling the back and they're ruling the knees, okay? One of the things that happens is you get the malar flush with the yin deficiency. Some of the heat comes up in the body. You ever seen the pictures of the women with lupus? I say women because it's like 9-to-1, women to men that get the disease. But malar is like a rash, looks like a butterfly, big red cheeks, big patches. That's a yin deficiency sign. Night sweats, when you're supposed to be at night, the yin is supposed to be controlling the yang. You're supposed to be at a place where everything is stable and the pores on the outside of the body are calmed down and settled and you hold your sweat in. But when the yin is deficient, the yang goes to the surface and goes upward and outward, and the pores open and you sweat and you actually lose your yin. So it's actually making itself worse over time. Poor memory, dizziness, constipation, dark urine. The yin is associated with fluids and blood, so when the fluids and blood are dried up and you're yin deficient, then you're going to see that the urine's more concentrated. Thirst. Thirst is more, when you have deficiency of the yin, oftentimes people get heat. Because, like I said before, the yin is supposed to control the yang. When the yin doesn't control the yang moves outward and has heat-like effects. Night sweats and hot flashes in menopausal women is probably the main way, the simplest way to understand yin deficiency, with deficiency heat. And then thirst is something that can happen in that case, or it can happen with people who have actual heat somewhere else in their body. A heat condition from an infection, from some stagnant emotions that built up and built into heat. A lot of different ways that heat can occur, but it would result in thirst. So excess conditions. In Chinese medicine we have heat, cold, damp, phlegm, wind, summer heat, qi, and blood stagnation. These are all excess types of conditions. These can exist in the body as pathological factors. And if you took the micro-rational approach and looked at it, you'd start seeing things like, oh, the person has some inflammation, or they have some immunological hyperactivity, or they've got hypercoagulation, or they're not breaking down their reactive oxygen species, they're having damage to the blood vessels. It would all start to play out over time as these pathological factors manifest. The phlegm and damp, as we talked a lot yesterday about the digestive system, turbidity in the system, the inability for the body to get rid of the turbid materials, the toxic type of byproducts of improper digestion, and it all builds up into something that's even more dense and sticky called phlegm that clouds the vessels and blocks the free flow of energy all over the body. We got to get rid of these things. And blood stagnation as an excess is something that, blood itself doesn't really have an excess, but when it's stuck like a river and it's blocked and it's built up, that's an excess. Then the energy is like pushing and it can't get through. That causes problems. That's an excess type of condition. Too much or not enough. Basic principle. We just want to understand this when we're treating our patients. I'm going to give you a bunch of herbs that you can use, but I just want you all to take the time in your life, in your practice, if you don't already, to understand what's the difference between someone having too much and not enough energy, too much or not enough blood, too much or not enough yin, too much or not enough yang. Like, what does that mean? And when you understand those things, you can just tailor your constitutional treatments more to the patient. Here's an excess tongue. It's got thick coat. You can see there's some yellow on there, cracks in the middle. This is a tongue on the right is even more dry. The heat has been burning up some of the fluids. This is like a phlegm and damp type of a condition where there's a buildup of turbidity in the body. And the tongue is so amazing. You look at the tongue, it's just like I said yesterday too, it's a dipstick down into the GI tract. You can just actually see what's going on in there. It's almost like checking your oil. Hey, what's going on? And here we have this look, and you say, wow, look at this. There's all this thick coat. And someone says, oh, I just had a blueberry juice. Well, it's not that. It's not that you just had tea. It's that there's a thick coat on your tongue, meaning that there's some kind of preponderance of a pathological factor, some kind of an excess. So the tongue becomes a really powerful part of our diagnostic tools. This one right here on the left has more of a greasy kind of look to it. So that's more of a phlegmy type of condition, where there's some kind of a sticky, phlegmy condition in the body. A deficiency tongue picture on the right, you can see that's a yin deficiency tongue, one that's more red in its color. It doesn't have as much of that moistening effect either. That the coat is very thin or scanty. It's got some cracks in it too, where the tissue's a little broken open. It's not nourished by the blood. That's deficient. And on the left is a picture of someone with more of a puffy tongue. That's got a puffiness, and you can see the scallops around the side, the tooth marks, and it's pale. That's a deficient tongue. That's more deficient with the spleen energies. Dampness with spleen deficiency. Digestive weakness. Okay? So I'm going to go straight into herbs. So these are TCHMs. Traditional Chinese herbal medicines. And there's just so much great research on TCHMs, because people actually said, well, there's a lot of validity to this Chinese medicine thing. It's been around for thousands of years. They've got as much writing on it as anything in the world. So let's take a look at what these compounds do, because in China they're studying all these things in clinical setting. They're actually studying these herbs and looking at how they interact and how they're able to affect things. And you can see here the idea that you've got Western medications and you've got TCHMs. Most of the stuff is directed at multi-component herbal decoctions and then some single herbal possibility, but the active compound part is what the kind of Western medical, the micro-rational mind is all about. They want to find out what's the active compound and how does it work and what does it affect. But I want to get back to how do we use these plants on a bigger level to address the patients in this macroecological way as well, where we can kind of apply the right herb for the right person at the right dosage in the right moment. So one of the things that came up around herbs in kidney disease is that people are afraid of them, because there's been studies that show that there's actually a pathology called Chinese herb nephropathy, which is just an unfortunate misnomer because there was basically a couple of instances where somebody got the wrong plant and they took huge doses of it and they had kidney problems with it. Well, that's not what happens when you use the right plant appropriately with a trained herbalist who knows how to use it. It doesn't happen like that. So the studies that are actually done on these damaging plants aren't actually accurate for herbalists, so you don't have to worry about them. All the plants we're talking about today are extremely safe. Ephedra, for one, used in weight loss products. It's such a bummer that plant got taken off of our shelves. Ephedra was one of my favorite plants. It was the most amazing thing for asthma that I ever experienced. And now I have to kind of, get it in sort of, well, we won't talk about that, but licorice. Licorice has been accused of being this hypertension problem, and it keeps coming up. And there is this very rare condition called pseudo-hyperaldosteronism, where someone can get a reaction to glyceric acid and can have a blood pressure increase. Normally, it's when somebody eats a lot of licorice candy. And if you look at the research out there on this condition, you'll find that most of the cases were people who were out eating lots of licorice candy and then went to the hospital with the problem, with elevated blood pressure. And they were like, "What'd you do?" "I ate a bunch of licorice candy, like 16 boxes of it." Well, that's not really like how we use licorice. Mostly we use a couple of grams in a formula as a harmonizer for the formula, as a way to balance the herbs and reduce toxicity of things that might have a higher dosage that needs to be balanced. So in the modern clinic, we've got empirical evidence from all the practitioners that we have, and I don't think we do. I don't think we wait, right? Let's move forward. Let's treat people with herbs. We don't have to wait until there's randomized, placebo-controlled, double-blinded clinical studies to prove that every herb or every supplement works for every condition. And that's kind of what, I try to interface a lot with medical doctors. I just was in a surgery recently with a general surgeon who's a friend of mine. I went in with a patient and got to see him do a right self-pingia-oophorectomy, and it was really cool. But I was like, wow, these guys really see life like the body is a car. It's like a mechanic. I'm going to take out your muffler and we'll put in a new one. Oh, we'll I'm going to change your transmission. It's kind of like that's how it's being seen. The body gets to be looked at that way, and we don't want to see it that way. We want to see it as an incredibly complex, integrated whole, and we want to support it. And so, but as I interface, I'm always faced with these people always having these, well, can you really use herbs? Aren't they safe? Are they, they've got all these toxins in them, aren't they? We don't know what they do. They haven't been studied. It's like, no, they have been studied. They've been used forever. You think we were all just stupid until we got like the randomized, placebo-controlled, double-blind study. And if anybody has the great idea of how we move forward to study these plants in a way that actually works, where we can actually say, hey, let's take a bunch of patients that come in with a problem, and they all get seen by different practitioners who all give them herbs, and we evaluate them and see how they did. Is there some other way to say that, yes, these herbs are safe, yes, these work for a lot of people? I don't know. If somebody has a great idea, let's get it out there, and let's start changing the way we do this. Otherwise, we're going to be stuck with all of our herbs becoming pharmaceuticals. That's where it's headed. Yes?
You have to reduce the dose of the herbs when the bone barrier filtration rate is down below 15.
No, actually, I end up with, because they'll be on dialysis at that point, and I sometimes don't have them take them like the morning before they go in, but generally I increase the dose of herbs, high doses, because we're dealing with things like, you're going to have anemia at that point, you're going to have protein loss, there's a lot of problems that you want to support, and so using more herbs actually is the way I've found to be able to help people.
How do you deal with an ichthyologist telling you stop all the supplement period?
Well, my first line is, hey, you're the patient, you're your advocate. So if you believe it, then you tell them that you're going to do what you want to do. The main things I have people be careful with if they're going in for surgery are things like fish oil, because there's just so much data on fish oil. Ginkgo, because it has the platelet aggregation issue. And then high doses of lumbrokinase I wouldn't do either before surgery. So other than that, I'm happy with people doing most herbs just almost right up until they do surgery. These herbs don't have a long half-life, and they're not acting like pharmaceuticals do. They don't just shut down processes. And of course, in life, with any drug, any therapy, anything, even if food, certain people react to certain things in ways that are unpredictable. And that's just life. If that one thing happens to one patient with one herb, oh, that herb's the devil. Well, you guys, 35 or 40,000 people die every year from NSAIDs, from aspirin. We still sell that stuff like gangbusters. So I'm not really interested in this kind of a control of our substances. I think we need to, for me, traditional usage is the first place that I look. Traditional usage of the plant. So key botanicals here, I want to hit these guys all really good. I'm just going to go right on to them. And astragalus, It's a wonderful herb. It's a chief herb in many formulas. This herb is amazing for the kidneys. Phenomenal. One of the things it does is it regenerates tissue. It promotes the production of blood and muscle growth. It builds the Wei Qi, the defensive Qi of the body. It interacts with the immune system. It keeps the immune system functioning. It tonifies and lifts the energy of the body. These are the Chinese medicine principles, the traditional medicine principles of astragalus. It's a spleen tonic. It tonifies and lifts. So it gives strength to the tissue. When we see what it does on the research side of things, it reduces proteinuria, attenuates kidney energy, downregulates these processes, induces the protection that we need so that you don't get this buildup of extracellular matrix and fibrosis. Inactivates free radicals, improves total cholesterol and albumin in patients with nephrotic syndrome. A lot of patients with nephrotic syndromes get cholesterol imbalances as well. So it's nice to see that it just balances the person on so many levels. This plant you dose pretty darn high too, especially in Chinese medicine. You use the whole herb. I like to use the whole plant, especially for the polysaccharides, which are water soluble. So make sure you're getting some water soluble components and not just alcohol extracts. More stuff, increases creatinine clearance, decreases blood pressure, increases serum albumin. It increases serum albumin. What a wonderful thing to do. Not only does it protect you from all these downstream problems, but it actually increases your serum albumin. That's a hard thing to do. When albumin levels fall in a person due to kidney disease, it's hard to get them back up. I like to do eggs. I do raw eggs, lots of them. Some people have talked about coconut. There's certain coconut things like, medium chain triglyceride treatments that can work. I'll do, raw eggs like an Orange Julius and have them do it, every day, like 4 raw eggs. It's a great way to rebuild the albumin. It just takes some time. It actually takes weeks to build the albumin back up. But when you use the herbs, it works. So I want to talk about salvia, Miltia rhizome. I talked about this one before. This is the Dan Shen. This is the Chinese salvia. It's a little bitter and cold. It invigorates the blood. It's a blood-moving herb that's great for the heart. And I always thought of it forever as a cardiovascular herb, but because of this connection with cardiovascular network and the kidneys, it makes so much sense that it would work with the vasculature inside the nephron, inside the kidney, surrounding the nephron. And it's just a beautiful thing. It does. It's a mild blood tonic. Well, Angelica, like we talked about, is more of a blood tonic. This one's more of a blood mover. And it also calms the nervous system down, calms the heart. Lots of great studies. Last 40 years in China, animal studies, they always use these things called 5/6 nephrectomized rats. And I'm like, are you kidding me? You cut out 5/6 of the rat's kidneys and then you study it. It's like, oh, God, can't we just go back to the fact that, this stuff works? Anti-inflammatory effects. It's got a lot of anti-inflammation. It lowers homocysteine. That's a big, homocysteine is a big inflammatory mediator. It's a very active and safe angiotensin-converting enzyme inhibitor. But remember, plants don't block pathways like drugs do. They work with the body to induce the body to do something different. It says, hey, you want to go over this way? I can help you. Like, here's a little extra support. The body's like, sweet, let's go this way. The drugs don't work very well for us because we're not robots. We don't function that well when you just say, don't do this. Now you're going to do this. Now you're not going to do this. The body has to figure out what's going on, work around. We don't like that. We like to be coaxed, helped. Lithospermate B, one of the main compounds in salvia. The things it does, free radical scavenging, decreases the blood pressure, improves electrolyte metabolism. And this plant you can dose pretty darn high too. It's got a lot of great research on it. It reduces that fibrinolytic pathway, helps keep the fibrin formation at a minimum, reduces blood stagnation through the blood this hypercoagulation inhibition. All the things it does here. I'm not going to read them all, but you can see it's just such a phenomenal plant. Daily dosage generally 5 to 10 grams, but up to 30 grams a day. It's totally safe. If a person's having bleeding in the urine and it's pretty excessive, you're going to want to do other things, like use the san chi, the nodo ginseng. Use another kind of plant. If people are bleeding, oftentimes what I'll do first is stop the bleeding right away, and then treat with the condition, whether they have a heat condition, they've got an infection, we'll treat that, but stop the bleeding, and then treat the thing that they're having problems with, the thing that's causing the bleeding. Combining this herb, frankincense and myrrh, those are big blood-moving herbs for us. I love frankincense and myrrh. Angelica and Panax ginseng, which becomes a great tonic. And Panax ginseng I didn't put up here I didn't find a lot of research on it, but it is another plant that I'm sure is very supportive because it tonifies the source qi of the kidneys. It's the only plant in the whole pharmacopoeia that does that. So, rhubarb. We always think of that plant as being this, amazing bowel stimulant, and it does have imodin and anthraquinone that does help promote bowel movements. But it also has this ability to clear out all the different toxins. Fire, heat, toxins, blood stagnation, dampness, damp heat. It just gets rid of all the bad stuff. It's amazing how it does that. And one of the things I was doing in the research I found is that they looked at this stuff in a lot of different contexts, and all these different treatments for chronic kidney disease in China, the rhubarb root was there in all of them because of its ability to clear all of these toxic waste products. Purgative diuretic resolves stagnation of blood, clears damp and turbidity, vitalizes the blood. You can combine it with tonics. And the anthraquinones, the imodin, the rayon, and aloimodin, these are all really studied for their effects on bowel promotion, but these are actually part of the compounds that are going to increase the getting rid of all these wastes, helping to clear the waste out of the body so that the system's clear and it can do its job again. Combining it with Salvia miltei, with Danshen. You can combine it with angiotensin-converting enzyme inhibitors. If people are on these drugs, all these plants you can give with the drug. You don't have to worry about it. One of the things that's interesting is that when you get into using this plant, dosing is obviously really important. When dosing was above 3 grams a day, people got diarrhea in this one big study on this plant, but 2/3 of them only, and the other third were able to handle it. And then when they went and resolved the dose down to less than 3 grams, people did really well. They started them at a low dose, and then they built them up slowly. They were able to help their chronic kidney disease symptoms, slow down their proteinuria, correct imbalances, and at the same time keep their bowels normal. But you got to start at a low dose and build it up slow. And that's the same thing we do, with this plant in Chinese medicine. You're combining it with other plants. You're doing it in a balanced formula. You're not really using it as a purgative. You're using it as a gentle way to move blood stagnation and promote the excretion of toxins. Cordyceps, right? This is the summer herb and the winter worm. That's Dongchong Shatao. This plant is amazing. There's always a mushroom in every lecture, it seems like. There's always some fungus. And this fungus does a great job of working with the kidney and the lung together. And the kidney and lung connection is really strong. In Chinese medicine, asthma is a kidney and lung combination most of the time. It's a kidney deficiency underlying the lung problem through the bronchioles and the bronchi. And this herb is almost always used in those conditions because it supports both. It tonifies the lung and it also tonifies the kidney. And it has this imbalancing effect on the relationship in the blood vessels between the two organs. Ophiocordyceps is the new name for cordyceps, and it came out about 2007. That was when it was discovered that it's really not a cordyceps. It's it just has nothing to do with the rest of them. So it's called Ophiocordyceps, and we just don't call it that yet. But you had this interesting review of 22 studies, almost 2,000 patients. Look at all the things it did. And it was using in combination with Western medicine. Reduces the proteinuria, increases clearance, decreases serum creatinine. It's got animal studies showing how much benefit it has. Allograft patients who already have had their renal transplants able to really benefit from this plant. Reduces their allograft nephropathy, which is something that happens. A lot of people that have nephropathic disorders after their transplant, then the nephropathy goes on to their new kidney. And actually about 35% of the folks waiting on transplant lists are actually previous donors. They've already gotten a kidney, and now their kidney is failing again. So again, if you just use an ACE inhibitor, and you just use your basic corticosteroid treatment or whatever else you're doing, you never fix the problem. So you put a new kidney in there. Well, the problem's the same. It's still the same cardiovascular network of that whole person there, same neurological network. So the same problem manifests again. Question? No. Okay, good. Nodo ginseng, love this plant. It's a plant that's been known as a styptic, as a way to stop bleeding, but really it's a plant that promotes the circulation of blood and removes blood stagnation, and it's really great for bleeding issues that are due to blood stagnation. So when stagnant blood builds up in the vessels, and the vessels start to extravasate because there's not enough flow, blood starts to move out of those semi-permeable membranes. Sanqi, Nodo ginseng, is really good at opening the channels, opening the blood flow, and allowing the bleeding to stop that way. It's a wonderful plant that has a lot of benefits, and it's got the same ginsenosides as the other Panax species, like Panax quinquefolius, Panax ginseng, right? Those are our other Panax plants. This also upregulates SIRT1, the sirtuins, which I think, Russ, we were talking about earlier, that, getting into telomeres, and it helps to protect the telomeres from damage. It inhibits transforming growth factor beta, which we know is a big inducer of fibrosis. TGF-beta, that inflammatory mediator, induces more fibrosis, so it inhibits the epithelial tissue inside. You better go back to that drawing. The epithelial tissue, the single layer of cells, gets damaged, and it starts to transition over to these fibroblasts that then grow more scar tissue. And so it blocks that from happening and preserves the function of the epithelial cells. It prevents radioactive oxygen species damage and the tubulo-interstitial damage.
What's the availability on that?
It's difficult at the moment, isn't it? I used to get it like no problem, and then all of a sudden my dispensary manager was like, yeah, I can't get Sanchi, I can't get Noda Ginseng. But there's one company I know, Legendary Herbs, they're in Taiwan. That's where I normally get them. I get my source for my powdered, and that's still available. But somehow locally with the Western herbalists, like I think I maybe contacted 7 or 8 American herbal companies in the last 2 weeks, and I couldn't find it. So I'm not sure. Anybody have information on that? Nope. Okay. Angelica. I don't want to talk a lot about this, but normally we combine it with astragalus, and you get a formula called Angelica to build the blood decoction, which I have a slide for you guys later on. And it just turns into this amazing way to support the bone marrow and build erythropoietin, which is the compound that stimulates the bone marrow to make red blood cells. It does that phenomenally well. It really builds the energy. It nourishes the chi in the blood of the body and creates a lot more anabolic activity. Cardamus flower, I talked about safflower. It's another blood-moving herb that's really beneficial in the kidney problems as well. As a blood mover, we're back to that idea of blood stagnation and fibrosis. That's what we're targeting. And of course, with these concepts I'm giving you, you can always take them and run with them and use other herbs. If you know other herbs that break up fibrosis, that target the kidneys, those will all be helpful as well. I'm just putting out the ones that I know and the ones that have a lot of good data backing up their use in chronic kidney disease. This SMAD 2 and 3, it's really cool because the TGF-beta is upstream. It comes out, it's being produced by cells in response to inflammatory indicators and stimulants, and it's inducing all these other pathways down below it. And when it happens, it's inducing this fibrosis to happen, these fibrotic pathways. And this Cardamus actually inhibits this thing called SMAD and blocks that fibrotic change and stops the fibrosis from occurring. And again, it's an herb that removes blood stagnation, activates blood stagnation, eliminates blood stasis. So again, macroecological concept applied to micro-rational concept works. We've got a lot of these examples. Radix bupleurum, love this plant. The psychosaponins, they're really great also at inhibiting a lot of the inflammation. This is a really good liver herb too, and obviously the liver connection to the kidney is really strong through the blood. And bupleurum is known as an herb that really helps the liver move. It helps to release the stagnation, the mental stagnation, the frustration, and the anger that comes with liver backup. A lot of anti-inflammatory action there. These plants, all these plants, you can dose them pretty darn high. I'm mostly using them as whole herbs, but a lot of folks here will use them as tinctures. And so in a tincture, they'd be like things that could be 20% of your tincture. These are safe herbs. I mean, obviously not the Da Huang, not the rhubarb, unless you really want to get them going. Yes?
Do you use them in tincture?
I do. I have that herb in tincture as well.
Tincture them, you tincture them together, or you mix them up?
Mix them afterwards. I would love to do them together, but like with the Chinese herbs, when you're making these herbal formulas, cooking them together is essential. It really makes everything marry in a way. And they did that. The Dongui Bushui Tong, that Angelica to build the blood decoction, it's a great example because they actually studied it. They took and they studied the plant and its effects, or the formula and its effects, whether they cooked them both together in traditional fashion from Li Gao's advice back in 1247 AD. They followed his example, and they got this huge erythropoietin effect on the bone marrow. And then they did it again, and they did the herbs separately. They cooked one herb here, Angelica, then they cooked the astragalus, same amount, put them together. They got 5% of what they got. So cooking them together and doing it traditionally is really important. Here's some formulas that are the kidney tonics. You've got the Jingui Shunchi one, which is like, and you can find these in patents. These are great kidney support formulas all the way around. They're going to support patients. The Dongui Bushui Tong, that's that Angelica formula. It's just astragalus and Angelica, and it's 5-to-1. And there's a slide in the back that says, it's got this laid out for you. 5 parts astragalus to 1 part Angelica, and that's the key. And that's a great formula to build chi and blood. So if the person's really hot and upset and angry and they're red in the face and they've got high blood pressure, they don't need that formula. But if they're weak and feeble and decrepit and they just really need some support, it's a great place to start. Then you can use those 2 herbs in the right ratio and then combine other herbs to nourish their kidneys. That's the 6 flavors tea pill, great for the kidney yin deficiency. Jingui Shunshiwan, I love that formula because it's the same formula. It's the 6 flavor decoction, but you add 2 herbs, aconite, and it's not the aconite napellus that you guys know about here. It's the aconite carmichaeli, and it's been prepared by boiling it and taking off the foam, all the toxic parts of it, over several hours, and then you're left with the hottest substance we have in the Chinese medical apothecary, versus the napelli, the Aconitum michaeli. That plant is the coldest plant we have in the Western pharmacopoeia. It shuts down the whole nervous system with 5 milliliters. Boom, death. So it's the opposite action. It's a similar kind of plant species, but just don't get confused. This has got aconite as an activator, as a yang-building plant. So here's this Dongwei Bushui Tong. I want to just kind of blow through these real quick for you guys. The ratio is so important. The things that it does. The Li Wei Di Huang Wan. You can get these in tea pills. They're really great that way. Restore the Right. This is more just directly kidney yang tonifying, building the kidney yang energy. And then we go into kidney nutrients. Magnesium, vitamin D, arginine. All these are really important. All these can be useful in your chronic kidney disease patients. So metabolic acidosis is the process by which the body is under stress of any kind, and you use up your buffer. And a lot of the buffer is coming from the bones. It's a great place for us to pull electrolytes, ions, into the body to make up for needs to keep our blood pH perfectly balanced. But when we do that, we start to weaken the bones further. So in a chronic kidney disease case, we want to stop weakening the bones, so we use things that take away acid. They're alkaline buffers. They're buffers that come from the exogenous source, and bicarbonate is the way to go. And in chronic kidney disease, a lot of folks suffer from metabolic acidosis. And I did a lot of research on that. I had to bang my head around it to try and freaking figure out, what the real deal was. And there was this study that came out. This is 2009. It was the first randomized controlled study showing that you take oral sodium bicarbonate, which has a lot of sodium in it too, but 1,800 milligrams a day in patients undergoing dialysis. You had major improvement, reduced protein catabolism, so proteins stay around longer, they're not getting broken down, reduced ammonia production and tubular damage. So folks do really well with small amounts of sodium bicarb. But I don't really use sodium bicarb. I like to use carbonates of magnesium, potassium, and calcium when I can, because there's a lot of sodium for a person to get in. Although they got, again, no change in blood pressure. We're kind of over the whole, stop taking salt altogether if you have high blood pressure, right? Are we? Okay. We need salt, right? We need sea salt. Use pH strips. Try to get the pH around 7 and hold it there with folks if you're not doing regular lab work. It's a great thing to do for people. You'll find that if they're running around with a pH of 5 or pH of 5.5, do the pH, have them check it a few times a day. If it's low, give them some more bicarbonate. Bring it up. If it's a urinary tract infection and they've got a high pH, a pH of 8, don't give them this. Give them cranberry juice and bring their pH down with acid. Bone health. We talked about the kidney network and its connection to the bone, right? It's a very complex interplay between the bones and the kidneys. In Chinese medicine, the kidneys make the bone marrow. The bone marrow makes the bones. So now we know in Western medicine that, of course, it is the kidneys that relate directly to the bones through vitamin D metabolism, through the uptake of calcium, through the release of calcium from the bones, through the parathyroid hormone. That's all happening from the kidneys. They're controlling that. Bone resorption and deposition. Vitamin D deficiency in chronic kidney disease, there's an Italian study, 83% of all of them had vitamin D deficiency. So having vitamin D deficiency to start with is a big issue, not only for chronic kidney disease, but then other problems, skeletal problems, and then also things like hypertension, anemia, things like metabolic syndrome. Vitamin D deficiency has a big role to play in all these disorders, all these kind of co-activating disorders. So one thing that's really important with this issue of vitamin D in chronic kidney disease is that you have this decline in folks over time. You're already probably vitamin D deficient. Why? Because probably you don't get out in the sun wearing your loincloth most of the days of the summer, right? You're probably wearing your clothes. You're probably in your car. You're probably in your house. You're probably at your work. You know what I mean? You're not really getting sun. People say, oh, it's summertime now. I'm going to get a lot of vitamin D. No, you're not. You need 2,000 IUs was estimated at about 15 minutes in the full sun is your naked body. Well, how often is your naked body in the full sun? Not very often. So vitamin D is really important. And getting sun is actually so key, you guys. It's most important. I dreamed about it last night. You got to get D from the skin. Okay? This was a cool study. Oral supplementation of vitamin D over 18 months raised people's vitamin D level 60%. They probably just didn't give them enough. You can definitely get it up faster than that. But UV irradiated people in 6 months had a 400% increase. So getting light from the sun, or even tanning beds, if they're safe tanning beds, what they do is they activate receptors in the skin that actually do part of the kidney's job. Because one of the things the kidney does that's really important is the kidney has an enzyme called alpha hydroxylase. 1-alpha-hydroxylase. And what does it do? It converts vitamin D from its storage form into its active form. That's really important because it's the active form that does stuff. That's the hormone that goes right into the bloodstream, right into every cell, right into the nucleus and directs function. That's really important for us. And it also goes into the intestines, and it allows us to take up calcium. Vitamin D, the activated form, and I'm just going to use the words calcidiol and calcitriol because the calcitriol is the activated form, and calcidiol is the inactivated form. We call them vitamin D3 and then vitamin D125 dihydroxycholecalciferol. But it's easier just to say calcidiol and calcitriol. So calcitriol stimulates calcium absorption in the intestines, suppresses parathyroid hormone and parathyroid hyperplasia. Well, that's a big thing because in chronic kidney disease, what happens for most people with the vitamin D deficiency is that calcium uptake in the intestines doesn't happen because you don't have that active vitamin D to tell the cells to take up calcium. So you don't. Then what happens? Well, the body's like, we need calcium. So the parathyroid gland's like, Jesus, no calcium. Okay, bones, let's go. Parathyroid hormone, give me some calcium. So the bones start dumping calcium into the bloodstream. And now you've got this relationship where the parathyroid glands start asking for more and more calcium, and you get this thing called hyperplasia in the parathyroid hyperplasia. And that's a big problem because this system is now broken down. And as you can see here, it's a very tightly controlled balance. You've got the kidneys there, and you see their interaction. There's that 1-alpha-hydroxylase enzyme, and it normally converts the vitamin D, affects the small intestine, normalizes calcium levels, and a lot of the stuff you see, it's all about normalization. It's about balance, and the body maintains the balance. It does it on its own. The cells actually function in a way that's harmonious with the whole, and we don't even know exactly how it all works, but getting in the middle of it is what normally people do, and oftentimes what happens is people who are undergoing dialysis will get given activated vitamin D, the active form. But the active form, when you give it, it really messes with the body. It doesn't really work. A lot of people actually fail on that therapy. That actually doesn't actually reduce their mortality. It actually leads to some problems, hypercalcemia and hyperphosphatemia. You've got to kind of keep controlling it. You're always trying to adjust the dosing. I found that just giving people vitamin D as the storage form, vitamin D3, and then having them get sunlight and having them get even going to, like I said, a safe tanning bed is a better way to get them vitamin D and let the body do the work of converting it. Because even if the kidney's damaged and it's not producing enough of that enzyme that's changing the D into its active form, bone cells do that. Skin cells do that. And when you activate the skin cells with the sun, they'll convert the D for us. So there are problems with giving people too much of the synthetic activated vitamin D forms. I don't like it. Yeah.
Quick question. When you're testing vitamin D level,
yes.
What you're aiming for?
I'm generally depends on the case. 50 to 100. If you had active cancer, we're really going after it. Maybe 60 to 80. In a person like this, maybe 60 to 80. Someone who's advanced chronic kidney disease, but you got to test both sides of it because if you have some kind of an inflammatory process, an infection, something like that, your body can be over-converting because the converted form is the form that activates the macrophages, turns on the immune system. So if your body's demanding a lot of vitamin D comes from the storage form over into the active form, then the storage form will look like it's low, but the active form will be really high. And that difference between the two, you want to know about that because if you just start dumping vitamin D in here, just test both. It's just 2 tests, yep. And if you test it once and see where the balance is, that's pretty good. Then the next time you can just follow up and keep the ratio. You figure the ratio is going to be kind of the same. Just keep doing, a finger prick for the vitamin D25OH, for the storage form.
Yes.
Yeah. Sorry.
I'm using vitamin K as well with balancing with vitamin D, so you're also reducing the calcifications.
Thank you for saying that. Yep. It was actually, as I was looking over my talk, I was like, God, I never put vitamin K in here. Vitamin K is actually the key to decalcifying the arteries. And vitamin D should really be given with vitamin K. It just should be. And a lot of products out there now are coming vitamin D with K. It's very important. And if you see the research coming out of Japan on vitamin K in osteoporosis, 45 milligrams a day of vitamin K2, 45 milligrams, not 45 micrograms, we're talking 3 orders of magnitude higher, that's the dose that they have recommended as the Japanese FDA for people with osteoporosis. And they have a 67% increase in bone density in people who are taking that amount of vitamin K2. And I have a lot of patients doing that right now. It's phenomenal. It's the best thing.
High dosage of K2.
How do you get it? So there's companies that make between 5 and 15 milligram capsules. Yep. For something like this, though, you could do, with a person who had calcified arteries. So remember, there was a study that came out some years ago, and it was done on rats, and they gave the rats enough vitamin D to cause them a high amount of calcium in their bloodstream, and the calcium in the bloodstream calcified their arteries. And what they did is they gave those rats vitamin K, and it reversed the calcification. So we all knew, vitamin K actually pulls the calcium out of the bloodstream and puts it back on the bones.
So what were the companies that have high dosage of K2?
One is called PEAK. It's called Advanced Orthomolecular Research is one of them, and Carlson's has one as well. So magnesium, kind of like magnesium in every talk. How do you not talk about magnesium? It's like the most amazing cation. It's just so important for so many different factors in the body. I often dose it in a case like this as high as I can get it before it starts having any bowel effects, because high magnesium will obviously cause you to have more bowel movements and cause diarrhea. And always start low, because if you get somebody to the point of diarrhea, they get upset. They don't want to touch magnesium again. They're scared. So you want to build them up real slow, and a lot of people benefit from that. But getting magnesium to be in the right level in the body is key for the bone health. It's key for the kidney health. Getting the balance between magnesium and potassium right. You don't have to do a bunch of testing. Just get people on a lot of magnesium. You're not going to get too much of it. If you've got too much, you're going to have diarrhea. It's not going to hurt you at any level right now. Having magnesium, but obviously you want people to have good nutrition. They should be taking B vitamins. They should have a good overall nutritive protocol, and then their botanicals, and they'll be doing great. Just give them a lot of magnesium. Low serum magnesium also leads to problems of conversion of vitamin D. You don't convert well when you don't have that magnesium. It helps in maintaining bone health. So you've got to maintain magnesium levels to keep patients with chronic kidney disease from losing their bone density. Regulates bone homeostasis. And again, vitamin K, vitamin D, and even little bits of vitamin A given with your vitamin D is really essential. Fatty vitamins, fat-soluble vitamins. Here's a couple of additional markers. This is called asymmetric dimethylarginine. And arginine is another nutrient that I give to patients with chronic kidney disease. Arginine induces nitric oxide, which can really help to dilate blood vessels and kind of help blood flow. It's also a really powerful regulator of growth hormone. When you combine it with lysine, just to prevent anybody from maybe getting a little bit of herpetic outbreaks, if they have herpes and they're arginine sensitive, you combine it with lysine and you'll have no problems. 9 grams a day in this study lowers the blood pressure from the American Heart Journal. I would look, this study is done by the Cleveland Heart Labs now. They do this, ADMA and the SDMA, symmetric dimethylarginine and asymmetric dimethylarginine. It relates to inflammatory processes and the problems with nitric oxide in the bloodstream. And so cardiovascular health they're looking at this as a marker, but the symmetric, the SDMA, is actually a good predictor of chronic kidney disease. So you can have patients get that test too to see kind of if this is an area you can help them. It's also something you can watch over time as a marker to see how they're doing. So some strategies: correct the underlying conditions, diabetes, hypertension. Get those constitutional factors together. Make sure you're treating the patient for who they are. Use your syndrome differentiation. If you understand Chinese medicine, use those kidney syndromes. I gave you a bunch of formulas that are there. If you can differentiate between the yin deficiency, yang, the essence deficiency, whether they have excess or deficiency in the first place, one of those 4 formulas, a lot of those plants you can give them, and you're going to help people. You're going to really help. I'm going to show you a couple things here. This is a patient of mine with multiple myeloma and chronic kidney disease. I think this patient probably wouldn't be here right now if we weren't giving him tons of herbs. He's been through the ringer. And it's really hard because if you don't, this is true with a lot of cancer cases. If you don't get rid of the cancer, you don't get rid of the the issues they're having. So if you're kind of holding them together, but the cancer's still growing, well, it's not long before the cancer growing is going to lead to the bigger problems. You can't stop the problems that are being caused unless you stop the cancer. And in multiple myeloma, it's the plasma cells in the bone marrow that are replicating on themselves, not leaving any room for other cells to grow. So you start being deficient in white blood cells, your immunoglobulins go down, you start having weaknesses all over the body, it starts to break down, and it's very inflammatory too. So in this guy, it's just really hard right now. I'm trying to get him on a little bit of thalidomide, because we haven't done anything with biomedicine since he did a bone marrow transplant last year. But if we can get him on a little bit of thalidomide, just a little bit, is a drug that's approved to treat this disorder. He could probably just pulse it off and on, and we'll just hold him together with herbs. I wish we didn't have to do that, but he's got this, he's got this protein that's just coming in the bloodstream all day long, every day, and it's just crushing his nephrons. It's just damaging them. So if we don't get rid of that, how long does he have? I don't know. He's on dialysis, and I've been, giving him a lot of herbs, and he's doing great. I mean, he's golfing, he's playing, he's having a great life, but we got to make sure that we get the cancer controlled. I just had to say that for you guys, because, with pain syndromes too, if you're like, all right, he's got pain, he's got a big sarcoma in his hip, we're going to give him a bunch of herbs. Oh man, if he's got that kind of pain in his hip with a sarcoma, you got to get the sarcoma to go away. It's just, everything else is it's like trying to put a piece of leather between an anvil and a hammer. It's just hard. These guys take tons of morphine. They'll take tons of all kinds of pain medications. It doesn't touch it. This formula, just to give you an example of putting together a powdered formula for the kidneys, reishi and cordyceps. It's a little bit of resveratrol powder, some centellin, that's from Centella asiatica from Gotu-Kola. You get those asiaticosides in there, the triterpenes. They really help to really stabilize blood vessels. We're trying to get back to that. How do I get the blood flow through this network and keep the fibrosis from keeping occurring? Control blood sugar. Just want to throw these up here for you guys. These are great herbs, all of them, for regulating blood sugar. Bone broth. I give patients bone broth all the time, especially kidney patients like this. And if, early on, if a patient has chronic kidney disease and they're having problems clearing out their nitrogenous waste, well, they're going to have to be a little careful with protein intake, right? They can't be eating the modern paleo diet where you go out and have burgers every day. It's not going to work. You've got to reduce your protein intake, be really careful about your diet, real specific. Lots of vegetables, lots of good fats, and a little bit of protein. But if you're on dialysis, now you're protein wasting, now you need to eat more protein. Okay? So you got to make sure you understand that distinction between being on dialysis, needing more protein due to protein wasting, and somebody being in chronic kidney disease and having trouble processing the nitrogen waste and then not giving them too much of a burden. Does that make sense? Okay. Bone broth ingredients and instructions that you guys can take a look at from my wife. And I put this in here too, some kidney-specific foods. I normally give my patients lists of foods like this. These are things that I really like for the kidneys. Wild game meats, bone broths, and bone marrow, just actually roasting the bones and scooping the marrow out of it. That's all the material. We talked about that connection between the kidney, the bone marrow, and the bones. Give the marrow to the person, and it's just like giving them support for the kidney. Some people, if they can handle it, could go eat kidney. Eat organ meats. Organ meats are great. They're phenomenal, especially when you have a kidney problem, you eat kidney. If you have a liver problem, you eat liver. I said that yesterday too, but it's really effective. These are just for your notes. One thing I love is asparagus, pureeing asparagus. So you steam it, you get it nice and soft, it's softer than you'd normally have it. Puree it, put it in the fridge, and just tablespoons throughout the day. Phenomenal kidney support. And asparagus, one of the plants we use is the shatavari, the tianmendong in Chinese medicine, the racemosa. That plant also is really nice. Not racemosa, sorry. It's the wild asparagus. That plant is really nice for nourishing the yin. It softens the tissue. It moistens things up, moistens the blood vessels. Remember, we're drying up and hardening. This is stuff that moistens us up and softens us. So asparagus is a really great way to go. Apple cider vinegar. Don't forget about hydrochloric acid. Make sure the digestion is strong. Limes and lemons are a great way to go. And that's it. I made it. Wow. Great. Cool. Happy to answer any questions you guys might have, too. Yes?
Is the dimethylarginine just a marker of problems, or is it a cause?
No, it's a marker. Dimethylarginine, is it a cause of problems or a marker? It's kind of, we don't really understand it yet, but we know there's a problem with nitric oxide in its relationship to arginine. And we don't know, the body's like processing arginine in a faulty way, but we don't know how to address it other than just giving arginine. And that's what all the studies say, just give arginine. Next.
I just had a comment. You know, when we're in clinic, we all have patients who are maybe at the end of life.
Yeah.
Very clearly. And I was just commenting, when we're in clinical practice, we may all be dealing with patients who are at the end of life. And one of the things that I think, if you have somebody with really end-stage kidney disease, but they're clearly at the end of life, clearly only have a few weeks to live or whatever, dying of renal failure is really not that bad of a way to go. You go into a coma. Once you get uremic, it basically is a narcosis, and you basically just go into a coma and then pass. So, informing patients of that so they can because oftentimes they'll still be offered dialysis even if they're at the end of life in Western, in American medicine, So, sometimes not passing up the opportunity for a good, peaceful death is, just.
No, it's a really great comment, actually, and being able to be not afraid of dying and us not being afraid to have that conversation with the patient when they wake up in the middle of the night and they're like, I'm going to die and I'm so afraid of it. Beautiful, yeah, and just helping support them. It's okay. Death is okay. It's a transition. You were next.
Does magnesium have to be tested intracellularly?
I mean, to get an accurate magnesium level, you really do need red blood cell levels. Yep. And I feel like just keep getting it in the body. Just keep getting it in the body for people, and that's the best we can do. Otherwise, you're going to do IVs and things. No, it's actually going to help. Yeah.
Is regular asparagus beneficial for kidney health?
That's what I meant. Regular asparagus.
Okay.
Yep. But I was just saying, if you want to intensify your food treatment, just make it real soft, puree it, and then eat it like a baby food, and just get it in like 4 times a day. Yeah, it's really good for the kidneys. Some people make that smell too in the urine. Their output has that asparagus smell. Some people don't. But I always thought of it as a good thing.
If a person has prostate cancer and early stage of renal disease, would ketogenic diet be appropriate?
Okay, so if a person has prostate cancer and they have early stage renal failure, renal disease, would a ketogenic diet be appropriate? It may be. I think they need more vegetables, though. I just think that the vegetable part of it is really important. And I don't know if the ketogenic diet would be, and definitely it's not a long-term solution because there's a lot of things like we talked about yesterday with the gut flora and things. I don't know what the balance would look like. I think you probably want to be more, vegetable-based in your diet. Yeah.
I just wanted to pass along. David Winston said that notoginseng right now is not passing tests for.
I asked if anybody had information. You didn't say anything.
Well, yeah, I just.
He said that the notoginseng coming over from China is not passing inspection for certain levels.